Hello, and welcome to the online presentation for what is CBD and how can we use it in dentistry. This online CE course is a collaboration between the Contemporary Health Career Institute and Cannabotanical Dentistry, and it is designed to start addressing the numerous questions about CBD and its potential therapeutic uses. My name is Jeff Scharf, and I'm the Director of New Product Development for Cannabotanical Dentistry. I've previously served as a regulatory manager for a medical device manufacturing company and have worked in dental education for over 15 years. I've developed numerous CE courses on a wide range of dental-related subjects, including radiology, safety, and have consulted with clinicians across the country in establishing their own dental educational facilities. Let me briefly introduce the different topics that we're going to cover today. We will start by answering the question, what are cannabinoids, which will help us to determine what is cannabis. We are going to take a look at a highly specialized structure called a cannabinoid receptor. We are going to take a look at some of the dental conditions that may be treatable by investigating the research that currently exists. I will introduce some basics about the production methodologies to get a better idea of how these products are made, before concluding with the product categories that exist and how they may be used in your own practice. By the end of this program, I hope that you'll begin to appreciate the possible benefits of CBD to your patients and how CBD and other cannabinoids may have the potential to revolutionize the practice of medicine. This is a very exciting time, and without further delay, let's get right into the lecture. So what are cannabinoids? This is a term that we've all seen, but do we actually know what it means? Well, cannabinoids are a class of chemical compounds that act on a cannabinoid receptors. We are going to look at receptors a bit later in the lecture, but for now, let's introduce two different categories of cannabinoids. The first category of cannabinoid that we are going to introduce are endocannabinoids. A combination of the words endogenous and cannabinoid, endocannabinoids are any cannabinoid naturally produced by the body. The most commonly discussed endocannabinoid is anandamide, but as I will discuss later, much of this research is relatively new. Having only been first isolated in 1992, anandamide is responsible for providing long-distance runners with a euphoric feeling of a runner's high that you may have heard mentioned or possibly even experienced for yourself. For this reason, it may also be called the bliss molecule. I also want to point out the hydrocarbon tail. You may recall this is indicative of a lipophilic molecule or fat-soluble molecule. That's a theme that's going to continue to come up throughout the lecture. Anandamide is broken down by another molecule called fatty acid amide hydrolase, and it's broken down relatively quickly. So what other sources of cannabinoids exist? We have a second major category that we are going to discuss, which are phytocannabinoids. Phyto means plant in Greek, so if an endocannabinoid is naturally produced by the body, then phytocannabinoids are any cannabinoid naturally produced by plants. So let's look at some common phytocannabinoids. Do you know what this is a picture of? This is a very commonly used phytocannabinoid. These are hops for making beer, and they contain humulene. Has anyone ever opened a beer and thought it smelled like cannabis? This is one everyone has tried. Any ideas? This is theobroma cacao, or raw cacao, which is the first ingredient in making chocolate, and it contains very high levels of anandamide. Who experiences pleasure when they eat raw chocolate? Yes, the anandamide may be responsible for this. Interestingly, powdered milk blocks the uptake of anandamide, which is why health experts recommend only consuming raw chocolate. Do you know what this purple flower is? I'm willing to bet everyone has heard of it. Most of you have even tried it at some point. Here are some hints. It's been taken for thousands of years and is taken for managing blood pressure, controlling blood sugar, a natural way to fight anxiety, for reducing inflammation. It is echinacea, and it's very high in alkaloids, another phytocannabinoid. Do those benefits sound familiar? What about this very common spice used in certain types of cuisine? The distinctive color might give it away. Well, this is turmeric, which contains very high levels of curcumin, and curcumin belongs to another class of important compounds called curcuminoids, which also have antioxidant and anti-inflammatory qualities. Curcumin has been taken for thousands of years for these purported health benefits. Here's a spice we use on a nearly daily basis. This is black pepper, which contains very high levels of beta-caryophyllene, and beta-caryophyllene carries wonderful documented health properties, including pain relief and anti-inflammatory properties. Fairly widespread in the plant kingdom, Beta-caryophyllene may also be found in relatively high levels in ginseng, cloves, rosemary, hops, and cannabis. Do you know this one? Well, these are black truffles, and they contain anandamide. You may have taken notice how many of the so-called superfoods contain very high levels of beneficial phytocannabinoids, and personally, I don't think this is an accident. Well, here are the two most well-known phytocannabinoids extracted from cannabis: delta-9 tetrahydrocannabinol, or THC, and cannabidiol, or CBD. While THC is responsible for providing users with a characteristic high associated with marijuana, CBD has other health benefits, but does not have any known psychoactive effects and will not intoxicate or impair the user. Again, I want to point out the hydrocarbon tails that exist on both molecules. That's indicative of a fat-soluble molecule, and while CBD and THC are the most prevalent phytocannabinoids by volume extracted from hemp, there are at least 116 unique phytocannabinoids that have been extracted from cannabis plants, and we are only just beginning to learn about some of their benefits. I do believe this list will continue to grow. Some of the other cannabinoids will come up throughout the lecture, but today we will primarily be discussing CBD, a molecule which constitutes roughly 10 to 40% of the total volume of cannabinoids extracted, depending on the particular species or strain of cannabis plant. So, speaking of different species, we've probably heard the terms marijuana, hemp, cannabis. Maybe we even use these terms interchangeably. But in order to get a better understanding of these terms, let's take a brief look at the family tree for Cannabaceae. Within the family Cannabaceae, we have cannabis, humulus, and 8 other genera. So why are these plants all included in the same family? What do these plants share in common? All of the plants in these genera share the presence of phytocannabinoids. You may remember the phytocannabinoid in hops was humulene, hence it falls within the Humulus genus. So, cannabis is a genus that contains 3 different species of cannabis, and you may have heard of them: Cannabis sativa, Cannabis indica, and Cannabis ruderalis, or, by its common name, hemp. These are the traditional differences among these common species. Sativa was traditionally recognized as being high in THC and low in CBD, while ruderalis was high in CBD and low in THC. So it's important to mention that selective breeding has taken place, so it is possible, for instance, to find Cannabis sativa that is high in CBD content, or Cannabis indica that is very low in CBD content. And at this point, plant geneticists are developing various strains that have ideal phytocannabinoid profiles for very specific uses. So, let's take a look back at the family tree for Cannabaceae. According to taxonomists that have developed this tree over many years, the biological definition of Cannabis ruderalis and hemp are the same. But the government defines it very differently. So this is no longer how we're going to recognize or define the hemp plant. Let's take a step back for a moment and look at drug scheduling, a concept you're all probably very familiar with. Just to remind everyone, according to the DEA, drugs are classified into 5 different categories based on the drug's acceptable medical use and abuse or dependency potential. Class 1 drugs have no acceptable medical uses and a high risk of dependency potential. Moving down the list, the risk for abuse and dependency is reduced. Schedule 4 drugs have a low risk of abuse and low risk of dependence. Let's briefly discuss some examples. Schedule 1 includes heroin, LSD, ecstasy, and peyote. Schedule 2 drugs will include prescription opiates, as well as cocaine and methamphetamine. Schedule 3 includes ketamine and anabolic steroids, while Schedule 4 will include the benzodiazepines typically prescribed for dental anxiety, like Xanax, Darvocet, and Valium, while Schedule 5 drugs include cough syrup with codeine. So based on these definitions, how do you think marijuana is scheduled? Marijuana is listed as a Schedule 1 drug with no acceptable medical use. But this is Epidiolex, which is used for treating Dravet syndrome, a condition which causes uncontrollable seizures in children. And Epidiolex is a solution of CBD designed to be taken orally. Epidiolex is extremely effective in treating this condition, and for this reason, it is an FDA-approved drug. The active ingredient is CBD sourced from hemp. Doesn't this conflict with the DEA's definition of no acceptable medical use? Did you know that federal funding and research grants are not available for researching Schedule I drugs? If you've ever heard or thought that the research into cannabinoids is lacking, I believe this may be the cause. Remember I mentioned that according to the biological definition, hemp and cannabis are the same thing? Well, the Farm Bill of 2018 changes the legal definition of hemp. We are now going to define non-hemp cannabis as any cannabis plant containing greater than 0.3% THC content. There are no legal protections for non-hemp cannabis, and this becomes a state issue. As you know, certain states allow for recreational or medical marijuana, while other states do not. For CBD to be legal according to the Farm Bill, it must be produced in a manner consistent with the Farm Bill, follows federal and state regulations, and produced by a licensed grower. It was only after the passing of the Farm Bill of 2018 that CBD products were legally able to be sold in commerce. Essentially, the Farm Bill shifted legal responsibility from the federal government to the state government. Let us revisit the definition of a cannabinoid, a class of chemical compounds that act on cannabinoid receptors. So, what are cannabinoid receptors? Well, what are receptors? Let's take a closer look. Let me just ask you for a moment, why is marijuana intoxicating? Has anyone ever thought about this? How does it get somebody high? You know, we've all learned that the body works like an amazingly efficient machine. Beneficial substances are broken down into usable forms and are delivered to their intended targets. Foreign substances are identified and filtered for removal. Well, why then did marijuana create an intoxicating effect in humans? It should have been identified as a foreign molecule and been removed from the system. If the molecule was permitted to pass, then it shouldn't have created a reaction in humans, but obviously it was. So the question researchers asked was, why did it get someone high? Funding was not available for cannabis research at that time, so researchers concluded that if the human body had structures that react to the presence of cannabinoids, then the body must create its own cannabinoids. It actually was not until the early 1970s that THC was identified as the compound providing a high to marijuana users. In the 1980s, researchers finally identified and described cannabinoid receptors in the human body, highly specialized structures that interacted with cannabinoids to create reactions in humans. There were two major discoveries in the 90s. A second type of cannabinoid receptor in humans was identified, and the first endocannabinoid, anandamide, was identified and isolated. After these important pieces of research came to light, it became impossible to deny the potential benefits of cannabis, and the race was on to learn more. So what are receptors? Receptors are highly specialized structures that are able to respond to external stimuli in order to communicate chemical messages within the system. Imagine a cell that's able to respond to light, heat, or other external stimuli and transmit a signal to a sensory nerve. For instance, when a bright light enters your eye, you blink. If you touch a hot stove, you take off your hand. These are receptors responding to stimuli and reacting. This communication occurs on a cellular level. So in many ways, I like to think this is the very first form of cellular communication devices. But really, how do receptors respond to external stimuli? While there are a few different types of receptors that each function differently, we're going to illustrate an example of how a typical G-protein coupled receptor functions in the body. You probably recognize this as a typical phospholipid bilayer of a cell. The bottom of this slide is the intracellular or inside area of the cell, and the top is going to represent the extracellular area. Receptors are protein molecules embedded within the phospholipid bilayer, extending to the outside and inside of the cell. On the outside of the cell is a highly specialized area called an active site, which is specially shaped to fit a specific molecule called a ligand. You may remember this lock and key concept. In this example, we're going to use CBD as our ligand, but all receptors work with a very similar concept and a very specific ligand. The yellow stars represent chemical messages that are communicated. Using receptors and chemical messages is the only way a cell can react in response to a change in its environment. Remember, it is essentially the method for a cell to remain healthy, or in a state of homeostasis. This model represents a system with ligands in the body. The ligands are in motion, and the more ligands, the more likely an interaction. It's like taking more CBD. So let's run through a very overly simplified model of how receptors operate in a system. What are they reading? Well, they're reading chemical messages, and these chemical messages can be ligands. Before the end of this lecture, this is going to be CBD. How are they reading these messages? Well, this is what happens when a ligand and an active site interact. The active site is specially shaped to fit the ligand like a lock and key. When the receptor is activated, it releases a chemical signal that's represented by the yellow star. And we can think of many examples in which a cell changes based on a reaction to an outside stimuli. Osmosis and diffusion are common examples in which an osmoreceptor is able to detect differences in solute concentration. Why do these cells undergo diffusion? Well, otherwise they wouldn't survive. That's their cellular protection, also known as a state of homeostasis. Realize that this is a very simplistic model, and the actual receptor and active site is far more complex. But this is essentially what is happening inside of the body. Here is a model of an actual cannabinoid receptor, and you can start to appreciate the complexity. Another example of receptors that we've probably learned about are insulin receptors. Insulin receptors on cells are responsible for detecting and regulating glucose levels in the blood. When insulin levels are high, cells break down glucose to store for use later. What would happen if somebody didn't have insulin for cells to detect? They wouldn't be able to regulate their blood sugar levels, and this is diabetes. Although we have many different types of receptors, there are two important takeaways. One, receptors respond to very specific stimuli, and two, receptors act to protect the health of the cell, helping the cells and organism maintain a state of homeostasis. So, current research suggests the cannabinoid system serves as a major homeostatic function in the body, related to sleeping, eating, relaxing, and healing. We know it affects the brain, the liver, the reproductive system, the cardiovascular system, the GI tract, and skeletal muscles, with over 65 known phytocannabinoid targets identified. In fact, there are two different types of cannabinoid receptors. The first type is called CB1 receptors, and they are primarily associated with the central nervous system. Highly concentrated in the brain, this receptor binds with THC to provide the euphoric high, but it is also found in the liver, the heart, pancreatic cells, and pain pathways in the spinal cord. If CB1 receptors in the brain are not activated by THC, the user will not get high. This means that THC may be used therapeutically without THC reaching CB1 receptors in the brain, for example, through topical applications. In general, CB2 receptors are primarily found in the immune system, but they're also distributed in cells of the spleen, reproductive tissues, and areas of the brain. Interestingly, this is more variable among species than CB1 receptors. CB1 receptors and CB2 receptors together make up what is known as the Mammalian Endogenous Cannabinoid System, or ECS. The ECS is believed to have developed over 6 million years ago, as the only family of organisms that's believed to lack a cannabinoid system are insects. So we're about to learn something very interesting about cannabinoids and receptors. Remember, the body has many different types of receptors, and each one is highly specialized for a very particular function. So has anyone ever heard of allosteric modulation? Maybe when dealing with enzymes. Let's take a look back at our model of a receptor. Remember, in this model we have CBD, which is a phytocannabinoid. Now we're going to modify the receptor slightly. Now our arrow-shaped site will be our active site. The site on top with the round shape is going to be called our allosteric site, and allosteric means other site. The molecule that binds with an allosteric site is called an effector, and you may remember from our previous example that the molecule that activates the active site is called a ligand. Let's add an available ligand to our system. Here is an endocannabinoid. Imagine this was naturally produced by the body. For instance, it could be anandamide. What happens when this endocannabinoid attempts to bind with the active site? Well, it looks like it could fit our active site, but not very efficiently. Let's see what happens when the effector binds with the allosteric site. Once CBD binds with the allosteric site, the shape of the active site actually changes. It goes through a conformational change. Ah, yes. This looks much better. The ligand can now bind with the active site far more efficiently. And, like our previous model, once the active site is activated, a chemical signal is communicated inside of the cell. Everything about this reaction is reversible. the allosteric modulator leaves the active site, and the active site will return to the original shape or conformation. The receptor will gain a new chemical signal. Now, what just happened here? The presence of a phytocannabinoid, in this case CBD, helped an endocannabinoid to perform its specialized function more effectively. While we showed CBD in this case, there is evidence to show that many phyto and endocannabinoids function in this synergistic manner. When a cannabinoid's function is benefited from the presence of another cannabinoid, we call this the entourage effect. This is a rather amazing phenomenon, but really, maybe it shouldn't come as that much of a surprise. Does anyone take flaxseed to help with cholesterol? Or garlic to lower your blood pressure? You're simply taking advantage of known biochemical synergies, of which many exist. For instance, a well-known cannabinoid system modulator is N-palmitoyl-ethanolamine, which increases receptor affinity to enhance endogenous anandamide activity and or reduce enzymatic anandamide degradation. Stated differently, N-palmitoyl-ethanolamine allows the body to create anandamide quicker or break it down slower, which both lead to more anandamide in the body. And who doesn't want more bliss? In a few minutes, I'll present some research that is going to show how opiates and cannabis work in a form of synergy and may even open the door to reduced dosages in opiate prescribing. But I want you to appreciate that biochemical synergies are constantly taking place. We already know of some, but many more will continue to be discovered. In addition to these chemical synergies, we also have important structural synergies. Now, up until this point, we've introduced a few structures and types of molecules. We've discussed cannabinoids produced by the body, we've discussed endogenous cannabinoid receptors, and we've discussed phytocannabinoids that occur from plants. And we've seen that these important structures are linked in some amazing ways. But the most important concept to understand about these very complex relationships is that all of these compounds and structures are working together to help the overall system maintain a state of homeostasis. Later in the lecture, I'll introduce you to some products that exist so you can start thinking about how you could begin to incorporate these into your own practice. But for now, let's look at some dental conditions that may be treated with CBD. We're going to break these conditions down into 3 different categories: anxiety, pain caused by inflammation, and then musculoskeletal disorders. Keep in mind, there is a lot of overlap, as musculoskeletal disorders frequently present as pain-related symptoms, and increased dental anxiety can lead to increased perceptions of pain. I personally want to mention that all of the information that's being presented in today's lecture comes from published research journals and documented clinical studies. I frequently hear that there's not any research that exists on cannabis, but this simply is not the case. While I do understand there's not a large volume of evidence that pertains to long-term clinical studies, that's simply a function of previous government regulations. If you're willing to dig just a little bit deeper into the information that is available, there's a plethora of data to support the use of cannabis in treating a multitude of dental medical conditions. I consider this topic to be of extreme importance because anxiety and dental phobia affect 1 in 4 patients. I hear this from both patients and clinicians, and it's frequently the cause of patients delaying or foregoing treatment and procedures taking longer than necessary. And unfortunately, too often, patients that suffer from major dental anxiety are not patients at all. So let's begin by looking at some published research. In a journal that compared previous studies, they concluded that recent studies report that cannabinoids help to regulate the fight or fight feelings by stabilizing stress hormones and thereby easing anxiety. In another study, in this evaluation, CBD appears to be better tolerated than routine psychiatric medications. Furthermore, CBD displays promise as a tool for reducing anxiety in clinical populations. In a journal produced by the Government of Canada, in a publication specific to cannabis for healthcare professionals, clinical studies also suggest that certain cannabinoids may improve sleep in patients with disturbances in sleep. Compared with a placebo, CBD products absorbed by the bloodstream significantly reduced medical procedure-induced anxiety, confirming several preclinical and clinical studies Recent studies indicate that acute doses of CBD can decrease anxiety. In a very recently released ADA report, cannabis is capable of anti-inflammatory properties. In another frequently referenced study, CBD can alleviate pain and prevent inflammation of gum tissue that can be experienced during dental procedures or dental cleaning appointments. Substances with antioxidant potential are known to improve wound healing and protect tissues from oxidative damage. CBD may have a regenerative effect in the treatment of oral ulcers. In a study from UC California and their Center for Medicinal Cannabis Research, smoked cannabis reduced daily pain by 34 to 40% compared with placebo. In an exhaustive review, the National Academies of Science and Medicine recently confirmed the efficacy of cannabis for chronic pain in adults. Let's briefly look at musculoskeletal disorders. Approximately 12% of adults suffer from some type of TMD. There is no widely accepted standard test now available to correctly diagnose TMJ disorders. Because the most common jaw joint and muscle problems are temporary and do not get worse, simple treatment may be all that is necessary to relieve discomfort. These data indicate that topical CBD application has therapeutic potential for relief of arthritis pain-related behaviors and inflammation without evident side effects. Let's take a brief look at some emerging uses in CBD in dentistry. One of the most promising areas of cannabis research includes opioid sparing. The primary use for both prescription opioids and cannabis are for analgesia. When given access to cannabis, individuals currently using opioids for chronic pain decrease their use of opioids by 40 to 60% and report that they prefer cannabis to opioids. One study testing multiple opioid agonists identified clear synergistic effects for delta-9 THC for most opioid drugs. Through meta-analysis, it was found that the doses of morphine and codeine required to produce the same analgesic effect were 3.6 and 9.5 times lower respectively when co-administered with delta-9 THC. This is some really compelling stuff. And then finally, 44 to 64% reductions in self-reported opioid consumption in cohorts of patients with chronic pain who were using cannabis. In these times where we're discussing an opioid epidemic in our country and prescribing doctors are being tasked with reducing the incidence of dependency, I believe this is an area where the research will continue to grow. Finally, I do think it's also important to mention some safety aspects of CBD and cannabis. There has been no documented evidence of death exclusively attributable to cannabis overdose to date 1650, most likely because of the sparse expression of CB1 receptors in the brainstem regions, responsible for respiratory and cardiovascular control. Many of the other journals also included safety aspects within their studies, and they also supported the safe use of CBD at varying levels within the body. So I hope you can begin to appreciate the uses for CBD are only just starting, and CBD may be a starting point for the development of new drugs in oral medicine. In a few minutes, we're going to take a look at some various categories of products that exist, so you can begin to start thinking about incorporating them into your own practice. But for now, let's take a look at how these products are manufactured. While different processes can yield different results, these are the essential steps to understand. The first step in the process is extraction, which you might remember from your organic chemistry days. Extraction is separating the desired products from the undesirable material, like plant material, fibrous plant matter, the waxes, chlorophyll, and other compounds that are not desirable to our final product. Plant material is placed into a solvent, and the cannabinoids will actually dissolve into that. We then take the liquid and remove the solvent, and what is left behind is the extracted phytocannabinoids, which typically has a thick liquid consistency. I want to introduce some industry terms. Now, these aren't industry standards, but they're widely accepted in the profession. Here's an example of a typical CBD product you may see. Notice the term full spectrum. This means it's going to contain all of the natural cannabinoids that were present in the original plant matter. It will include essential oils, other cannabinoids, and terpenes. Terpenes are another common term you may see, and these are the active aromatic compounds that give cannabis its distinctive smell, but it only constitutes roughly 1 to 4% of the oil. So, looking at the original chart of cannabinoids in cannabis, a full spectrum product contains all of the natural cannabinoids. I want you to notice, if the original cannabis plant contained THC, the full spectrum extraction will also contain THC, and it might be in quite high levels. However, through advanced chemistry, we are actually able to remove the THC. If we remove the THC, then we are left with what is called a broad spectrum oil. Broad spectrum typically means all cannabinoids except THC, or sometimes less than 0.3% THC. Another term you may see is phytocannabinoid rich, or PCR. This means it contains many phytocannabinoids, and basically we're just trying to realize any benefits that might be offered from the entourage effect. So if we continue to extract and purify a single component out of our solution, we could be left with a nearly pure product, and at this stage it's called an isolate. In its purest form, CBD is actually a crystal, typically called CBD isolate, and it's actually possible to purchase any of these products. But if you see a product that says isolate, unless it's a powder, it'll actually be CBD isolate added to a carrier oil. So I've been seeing more companies promote the method of extraction they use to obtain their products. Primarily it's supercritical, CO2, or solvent or a solvent-free extraction methodology. So the concept of chemical extractions is not new in chemistry. Reputable companies test their products at every step along the way. So some less scrupulous companies were performing inferior extractions, which had the potential to leave solvents in the final products. But really, this should not be a concern if you are purchasing the product from a reputable source. In a few minutes, I'll actually show you a way to be able to check. My personal recommendation is that if you're purchasing the products from reputable companies, I would not worry about the particular type of extraction that's being performed. But this does lead me to another very important point, and that is that all products are not created equal. CBD products are currently considered over-the-counter, and OTC products are not regulated by the FDA. So how can you be sure you're getting safe products? Well, one thing to look for is GMP, or Good Manufacturing Practices. These basically are voluntary manufacturing industry standards, but it's generally a good indicator that products are being manufactured safely. Another way of knowing you're getting a safe product is by obtaining a certificate of analysis, or a COA. The COA is designed to show you what is in the product in terms of concentrations, but also what is not in the product in terms of showing that it's solvent and pesticide free. Many more companies are providing QR codes on their product that'll take you directly to a COA online. Now that you have a better understanding of how these products are manufactured, let's take a look at some of the categories of products that exist. We'll break them down into 3 categories: orally ingested products, topical products, and inhaled products. Orally ingested products include pills. This is an oil that is designed to be placed under the tongue to be absorbed by blood vessels in the mouth to quickly reach the bloodstream. The effects of a sublingual oil are fairly immediate, and it has a comparatively high absorption rate. Some people find the taste to be unpalatable, and others scoff at the delivery method of a dropper in a bottle. Here's another product, edibles or gummies, and they've become very popular due to their ease of use and consistent dosing. Additives may also be used to convert beverage or food items into CBD or beverages. This is CBD water, for instance. Other companies even sell Keurig-style pods to make CBD coffee. This is a product designed specifically for the dental patient, and this is a selection of 3 different CBD pills designed to be taken before, during, and after the dental appointment. The first pill mixes CBD with melatonin to provide the patient with a relaxed night of sleep the night before their dental appointment. It also begins to titrate bioavailable CBD into the system of the patient. The second pill, which is designed to be taken the morning of the dental appointment, will continue to boost the levels of bioavailable CBD in the patient's system. The final pill is designed to be taken at the dental appointment to provide the final boost of bioavailable CBD into the patient's system. It also includes curcumin, so the patient may realize additional benefits through the antioxidant and anti-inflammation properties provided from the curcuminoid. The appointment pack is designed to help the patient sleep easier, relax during their dental appointment, and heal in a more expedited fashion. While we're on the topic of methods of delivery, I want to discuss a very important point, and that is the difference between fat-soluble molecules and water-soluble molecules. We all know they don't mix, and we know that we're water-based creatures. Almost everything we eat is converted into a water-soluble form for release into the bloodstream. But we also know that many cannabinoids that we've looked at are fat-soluble molecules. So this can present a major problem when getting the molecules into the body in a way that'll make them work. How much of a problem? Well, a big problem. As a point of example, let's look at common vitamins. This is not a cannabinoid. It's actually vitamin E. And you may be able to recognize this type of molecule as being fat-soluble at this point by the hydrocarbon tail. Now this is vitamin C, and it's a water-soluble molecule. So let's look at how this impacts the body's uptake of these two vitamins through an example. Imagine we're going to take a multivitamin with equal amounts of vitamin C and vitamin E. How much do you believe would be used by your body? Amazingly, 60 to 90% of the vitamin C will probably end up in your bloodstream. But the chances are very good that only about 5% of the vitamin E in the tablet will ever end up in your bloodstream. So the body clearly has challenges absorbing fat-soluble vitamins. And to illustrate this point, let's compare alcohol and cannabis. Alcohol is water-soluble and it's easily absorbed into the bloodstream. If you take a breathalyzer test 24 or 36 hours after you've stopped using any alcohol, it would certainly all be out of your system. Cannabis is fat-soluble. If you use cannabis and take a test, it could certainly show up in your system 3 and 4 weeks after. Residual amounts of cannabinoids actually will reach your fat storage locations, for instance in your liver. So this could present a problem because many of the molecules that we're discussing are fat-soluble. So this is going to introduce a very important term, and that is bioavailability. This is the proportion of a drug or other substance that enters the circulation when introduced into the body and so is able to have an effect. Basically, how much CBD reaches the bloodstream. It's an important concept because not all products are necessarily equivalent when considering bioavailability. For instance, if you eat large amounts of marijuana, you would likely not experience any effects, despite having ingested a large dose of THC, CBD, and other cannabinoids. The THC and CBD are not in a usable form for the body. The body cannot absorb the cannabinoids, and thus, they don't become bioavailable. So if we have fat-soluble molecules, and we need to get them into water-based life forms, what can we do? An emulsion is when you take two normally immiscible substances and force them to become mixed. For instance, vinaigrette is taking oil and vinegar, shaking vigorously, and obtaining a cohesive blended salad dressing. Now, eventually these two would settle out of their emulsion, but it is also possible to obtain stable emulsions. The most famous emulsion, or the emulsion that everyone is familiar with, is mayonnaise. This is an emulsion of an oil and an acid, generally vinegar or lemon juice. These two molecules are emulsified by egg yolk. Important to notice, this is a stable emulsion. Leave the mayonnaise and the oil and vinegar will not separate. How did this happen? Well, first, the oil is broken down into tiny droplets and chemically treated with an emulsifying agent. What we see here is a droplet of oil surrounded by water-soluble molecules, and thus, the entire oil droplet is now water-soluble. Looking at the outside area listed as water, you can imagine this is the bloodstream. The oil droplet is able to mix with the blood and become bioavailable. A water-soluble oil droplet is called a liposome. This is a more accurate representation of what a liposome looks like on a molecular level, and this is fully absorbable by the bloodstream. While we're now able to overcome the issue of water and fat solubility, we do have a secondary hurdle to bioavailability that we have to discuss, and that is first-pass metabolism. First-pass metabolism is a phenomenon whereby the concentration of a drug is greatly reduced before it reaches systemic circulation. Let's take a look back at our liposome. Now, imagine we're going to take our liposome through additional treatments by breaking down the size of the droplet even further. We continue to break the oil down until the average droplet diameter is only approximately 25 nanometers. This is now called a liposomal nanoemulsion. Due to their small size, the individual oil droplets are now able to pass directly through the intestinal membranes, so the beneficial molecules can be delivered directly to the bloodstream. Both of these treatments combine to dramatically increase the overall bioavailability of our products. These are the advanced production methodologies being used by some companies to gain an advantage and ultimately increase the bioavailability of the CBD products consumers are taking. Let's look at another category of product, which are topically applied products. Cannabinoids are prepared in various ways for topical application on the epidermis. You may see these in a variety of forms, including creams and lotions, salves, but many of these products have additives to provide additional effects. For instance, menthol components frequently could be added to provide a cooling effect, but these products are not suitable for facial application, as the menthol vapors may affect the eye, and other additives may also have other negative interactions. Prices within these categories of products can vary wildly, but remember, not all products are created equal. This is a product called TMJ Relief that is designed for application directly to the facial area of the temporomandibular joint. It is a custom formulation with transdermal emu oil, providing maximum bioavailability to the CBD and may be used multiple times throughout the day. Feedback is that this product works very quickly and patients appreciate the portability and convenience. Let's discuss another category of product, and that's inhalation products. You're probably familiar with this type of ingestion. Smoking combusts the dried product, releasing the phytocannabinoids and any other compounds found in the flower, which are then inhaled into the lungs and absorbed directly into the bloodstream. This is vaporizing, which everyone has probably seen at this point. Vaporizing is slightly different than smoking in that the desired products are added to a carrier like propylene glycol. When heat is added to the mixture, propylene glycol evaporates as water vapor, which is vaping, while the other products are absorbed into the lungs. Vaporizing is extremely quick acting and becoming accessible to a much wider demographic of patients. Let's compare the various methods, beginning with oral ingestion. Some of the pros include the ease of use. It's quite long-lasting. There's a consistent quantity of active ingredient. They can be quite portable. There is a certain familiarity. For instance, imagine providing CBD to a geriatric patient. They're likely far more comfortable with the product in a pill form as opposed to a vaporizer. Furthermore, the products may be treated to increase bioavailability. Oral ingestion may take a longer time to take effect, and ingested items are exposed to the first-pass metabolism, which may make this method less efficient. Some people also find these products to be a bit unpalatable. In general, the onset for pills is between 45 and 90 minutes, and they may last between 8 and 10 hours. The onset for edibles is a little bit longer, between 1 and 6 hours, and for that reason they may also last longer, between 8 and 15 hours. While sublingual oils will take effect much quicker, between 20 and 30 minutes, their duration typically is also shorter, between 5 and 8 hours. But it is important to realize that these effects are unique to the individual and they may vary by person. Some of the benefits of topical products are that they're very easy to apply, and you can apply them directly where the relief is needed. They're also very fast acting and they're non-intoxicating. However, they're not always the most efficient, and localized administration means that we may be missing out on some of the full body benefits, the entourage effect, if you will. Some topical products are also not always as portable. The onset is quite quick, between 5 and 10 minutes, and they may last between 8 and 10 hours. Finally, when discussing inhaled products, some of the pros are that they're very fast acting, and very particular formulas may be used. In general, they're considered a very efficient method of delivery. However, there's not always consistent dosing. For instance, does one puff from a vaporizer always provide the same amount of active product? There are also some stigmas associated with smoking and vaping. There are also questions about its social acceptance and its legality. In general, the onset is quite quick, between 5 and 15 minutes, and it may last between 2 and 4 hours, but again, I want to remind you that these effects may vary by individual. This concludes the online presentation for what is CBD and how can we use it in dentistry. I hope it provided you with some interesting information and it got you to start thinking about how CBD may be able to be incorporated into your own practice. The future is very exciting and we're really just now beginning to learn about some of the benefits that CBD may be able to provide. You really should consider yourself a pioneer in your profession. This is really just the beginning, and what the future holds is very, very exciting.